Hi, Dr. Gan from Dr. Vein Medical Clinic. Lasers have become such a common word that most households know what they are. They come in some form of treatment, whether it be lasers to your eyes, lasers to your skin, your face, or even other parts of your body. Now, we receive a lot of phone calls from patients asking us about laser treatment for their veins. There are many clinics out there offering laser treatments in some way or form, but not all lasers are the same. In today's video, I'm going to break down the different forms of treatment, specifically laser treatment for vein disease. Now, it may come as a shock or surprise to you that laser is an acronym for a longer word, and essentially it means light amplification by stimulated emission of radiation. I reckon laser is probably an easier word to use because no one's going to remember the longer form. Now, to break down what lasers actually do, essentially they amplify energy at different frequencies and target different parts of your body. And by doing this, they can avoid damaging tissues that we're not actually aiming at. And so lasers for vein disease can come in two forms. Now, the first form is the superficial lasers, which is what a lot of patients talk about. Now, these superficial lasers target the spider veins or even abnormal vessels that you can find on your legs, on your abdomen, on your face, even these broken capillaries. So they're quite targeted for these vessels, and they're targeted by having different frequencies, as I mentioned earlier. Now, they work really well as long as there is no deeper cause of vein disease. What I mean by this is that sometimes when you look at your leg, you can see a bunch of spider veins or even little clusters of spider veins here and there. And you may also see some greenish bulging veins, not very big, but you can kind of see these greenish veins and also these big varicose veins. Now, if you do not treat the varicose veins or these little green veins, what will happen is that they will continue to feed into these spider veins. What will happen eventually if you do have laser is that these bunches or clusters of spider veins will actually get even worse over time, and sometimes they may go away after initial treatment, but then they'll come back very soon within 3 to 6 months. So it's always important to sort of get the deeper veins treated before you even touch the spider veins. The other thing about superficial lasers is that sometimes certain lasers can do 10 different things. They can do your face, they can do this, they can do that, they can do resurfacing. But getting a specific vascular laser that sort of targets these vessels is one of the lasers that will make a huge difference in terms of the number of treatments you may need. At our clinic, we use a dedicated vascular laser, and all it does is focuses on these abnormal vessels, whether it be spider veins, broken capillaries on your face, or even these vessels on different parts of your body. And because they're so targeted and the energy emitted from these lasers is quite strong, we can often get rid of these veins quite quickly with a number of treatments rather than having 4, 5, 6 treatments. The second form of laser treatment for veins is what is known as an endovenous laser. And essentially an endovenous laser is basically putting a laser fiber directly into the vein itself. And what it does is it creates energy or heat energy that disrupts the inner lining of the walls of the vein and destroys it. Now, this form of treatment is more for patients that have deeper causes of their varicose veins. Now, in a previous video, I've actually explained that you sort of have 3 levels where you have your deep or your big pipe, which is what I'm talking about right now. Then you got your middle level, which is these veins that you may see bulging out of your skin, and they often are quite pronounced. And then you got the little small spider veins. So the endovenous lasers are basically targeting these deeper pipes that lie within your leg. The only way to find out whether these veins are not working is to get a duplex ultrasound examination looking at these veins. At our clinic, every time you come in for a consultation, every patient gets an ultrasound examination because we tend to look for the root cause of vein disease rather than just treat these branches or have a band-aid effect for these small little spider veins. It's important to treat the cause before we can treat the smaller veins. I hope this gives you a little bit of clarity about the different lasers available for vein disease. To sort of get rid of that confusion about getting my veins lasered when we're talking about superficial lasers versus getting my deeper veins treated, which is sort of the endovenous lasers. And if you're interested in any further treatment, please feel free to contact our clinic or visit our website at drvein.com.au to find out a lot more information about vein disease.